Hi, I'm Dr. Kim Groves, a licensed clinical psychologist at the Center for Emotional Health of Greater Philadelphia. Today I'm going to talk about the comparison that is being made between combat war and the war against COVID-19. I understand that there's been some mixed reactions about this, so I wanted to share the psychological perspective on it. The news tends to focus on the number of deaths that have occurred compared to wartime and workers on the front lines having to kind of fight with limited and changing data and armor. But from a psychological standpoint, trauma, regardless of specifics, elicits the same physiological reaction when triggered. Many people are familiar with the saying flight or fight. There's been much research on this process, and many researchers have more specifically termed this freeze, flight, fight, or fright. When a human is faced with a perceived threat to their survival or the survival of others around them, a part of the brain called the amygdala sends a distress signal to another part of the brain called the hypothalamus. This part of the brain then communicates with the rest of the body through our sympathetic nervous system. This will send signals to various glands that release epinephrine. Epinephrine then increases your heart rate and blood flow to different muscles in the body. Small airways in the lungs begin to open up. More oxygen gets sent to the brain, causing increased alertness and visual acuity. And glucose is released into the bloodstream to supply the person with the energy they would need to either flee or fight. If the threat remains, secondary process occurs where the hypothalamus then releases hormones that secrete cortisol into the system. This allows the body to remain on high alert. Once the threat passes, our parasympathetic system kicks in and cortisol levels decrease and the body can decompress. All this happens very rapidly and is adaptive to survival when a threat is present. When considering being on the front lines during a war or currently in the ER, however, there's likely perceived threat to varying degrees much of the time. The body may not be in full fight or flight, but for many, it's also not fully at rest. Even for those who can find rest, there is likely repeated exposure to potential threats and therefore multiple experiences of being in a state of flight or fight. The frequency of this can cause the brain to become somewhat trained and used to doing this and firing in this manner, which can lead to a misfiring of the system in the future. The brain can start to respond to stimuli in its environment as a threat when in fact it's not. This can be one of the early indicators of acute stress disorder, which has the potential to develop into post-traumatic stress disorder. There's also a unique challenge to the option of fleeing when you consider being at war or on the front lines during COVID. Evolutionary studies have shown that the natural process of flight or fight is to first freeze, take in the information, try to flee, and if unable, having to fight or get stuck in fright or what we call tonic immobility. This can look like playing dead if you consider evolution, or being suddenly immobile, unable to speak, or dissociating from reality to a certain extent, which people might call survival mode. At war, if in battle, soldiers are of course trained to stay when a threat is present in order to defeat the enemy. In the hospital, the physicians, nurses, and staff have also been trained to stay and care for their patients, despite the potential of becoming ill themselves, being subjected to patients in severe distress, watching people die alone, and the list goes on. While this is necessary in both cases, not having the option to flee increases the psychological tension of the flight or fight process. This can affect their emotional response to the event and how they recall it. For individuals who become stuck in the fright or remain frozen during a prolonged trauma, such as being at war or again on the front lines now, it can be very taxing and damaging to their mental health. Many studies about war veterans have correlated being frozen and the development of post-traumatic stress disorder. Not all veterans experience this, just as not all healthcare workers will, but the ones who are, however, may feel unable to address it or not know how to. When in war, you can't just go home, and if you're at work in a hospital right now, there's likely many reasons people can't just quit their job. What is different now, though, is that you can reach out for help. It's important to process what is going on, and possible to do so without falling apart or becoming unable to continue your job. The danger is more so living in a chronic state of fear or distress that could be more difficult to impact if stuffed for too long. Much of the research on veterans after the Vietnam War provided data that this type of prolonged trauma led to an initial onset of PTSD symptoms immediately after the event, but the peak of symptoms didn't present until about 2 to 3 years later. At that point, PTSD is considered chronic and can lead to many different psychological and physical complications. Regardless of the comparison of wartime, if it makes sense or if it's rational, I think from a psychological perspective, it is certainly something to consider. We have the knowledge from the past of how war and prolonged trauma impacted veterans, so why not use this to help guide treatment for anyone experiencing a similar physiological process at this time? If you or anyone you know is experiencing distress, avoiding talking about their experiences, having flashbacks, nightmares, demonstrating an increased startle response, or seems depressed, be sure to reach out for help. Early intervention is best. I hope you found this useful. Please feel free to share it. My colleagues and I at CEH are dedicated to specialized care in the evidence-based practice of anxiety disorders, OCD and related disorders, and neurodevelopmental disorders. And we are available to provide telehealth via secure internet video conferencing. Thank you for watching. Be well.